Hello baby girl, welcome back to the channel. Get your drink, okay? Come on in, I'm ready for you. Cheers. So just a soda water here. Let's begin the vlog. It's gonna be all about dental hygiene school, okay? So this is series 3. We're gonna be talking about local anesthesia, community health, and ethics. So stay tuned for the video. And if you haven't already, I don't want to say give it a like because you got to watch it first, right? But subscribe to the channel. So towards last semester, we ended up having to take a local anesthesia course, and we had to inject each other. So prepare yourself for that. We didn't use a live patient. We practiced on each other. I gave so many injections to my classmates, and they gave so many injections to myself. I don't remember how many we had to do. For me, the most painful one was the palatal injections. The tissue up here in the palate is so keratinized that it was so painful. I actually wasn't scared when I was doing local anesthesia. Surprisingly, I actually really enjoyed it. I mean, I wasn't nervous at all. I'm gonna link some pictures somewhere in the video. I was very comfortable doing it, and I kept telling myself, you got this. You're gonna be fine, blah blah blah. You know myself already. So when I was giving local anesthesia to my classmates, I was very comfortable. I kept telling myself that I've been doing it for many years, and I think I started believing it. And I watched a lot of YouTube videos. There was one video from Hygiene Edge that they were showing how to give injections. I watched a lot of those, so those were very helpful. I'm very visual, so I watched a lot of videos before I gave my first injections. And I think I did pretty good. Even now, I like giving injections. I love giving the PSA, ASA, the IA, anytime I do a deep cleaning. So very helpful. I'm not sure if in your state you're allowed to give local anesthesia, but in Massachusetts, you are. As hygienists, we are licensed to give local anesthesia. We just have to take out a permit. And in my school, they added local anesthesia to the course, so I didn't have to take like an extra course. It was just part of my 2-year degree. One advice I will give you is, if in your state you are allowed to give local anesthesia and your school program doesn't provide it, even if you have to pay for it and take it, like do it, it's just gonna make you a valuable hygienist. I mean, dentists are gonna be happy that you have your license so that they don't have to be numbing your patients for like deep cleanings or for patients that are extremely sensitive. So invest in your career, baby girl. Was there a lot of math involved in local anesthesia? There was some, you know, I'm not gonna lie, but it wasn't like wicked complicated. It's not like calculus hard, you know. So I think you'll be fine with the math. We learned a lot of things about like adverse reactions, you know, local anesthesia toxicity, what patients we shouldn't give certain anesthetics to, what anesthetics work best for upper versus lower arch, like things like that, you know. I remember in hygiene school, they told us that we had to ask older men if they have taken Viagra in the last like 24 hours. And I was like, I'm not really comfortable with asking those questions. You know, I'm a little shy. But once we learned why we had to do it, then I was like, all right, you know, I could save somebody's life. Because if we give them lidocaine with epinephrine and they took the Viagra like, you know, the night before or something, they could get like a heart attack or something. So very important that we ask all these medical history questions, because we just gotta make sure our patients stay safe, you know. We learn how to inject on a hot dog. I'm gonna link a picture up there somewhere. I am not lying to you. We really did. We were like injecting oranges, injecting hot dogs.
And then we injected each other.
Was local anesthesia hard? No, I don't think so. I honestly thought dental materials was more of a hassle for me, because I wasn't good at, like I said, alginate impressions and pouring models. They always used to have bubbles. They still have bubbles. So that's the one class that I was like, I don't like it. But all the other ones, like local anesthesia, it wasn't a big deal. At least not for me. I I liked it. So for community health, again, it was towards like, I think 3rd or 4th semester that we took. We used to go to like different elementary schools and give like little presentations on dental hygiene, as well as like projects. I remember like showing kids how much sugar is on a Gatorade and putting like hard-boiled eggs in Coca-Cola and showing them how bad it stains their teeth. I also remember doing like trivia questions for them and like little games. And with community health, not only are we like helping children, because we did go into a school and we gave fluoride varnish to the children. Not only are we providing services and educating these kids, but we are also learning how to deal with different age groups. Because let me tell you, sometimes we mistake talking to a 3-year-old and an 11-year-old. Sometimes I'm like, oh, look at Mr. Thirsty, and they're like, I'm 11. So every child, we have to treat them according to their age, words we use with them, the way we talk to them, what we talk about. Depending on the age, the younger kids, they can't be sitting there for like 45 minutes, like getting a cleaning done. Like the cleanings have to be quick because their attention span is like gone.
Excuse me.
Sorry guys. I really enjoy community health because I felt like we were giving back to the community. We also rotated in nursing homes, and that was such a beautiful experience that I had. I mean, just remembering some of these patients, it just makes my heart joyful, but at the same time sad. A lot of the patients, we were going there to brush their teeth. We also went to a hospital to do these services. All we were doing is brushing their teeth because the nurses, they don't have time to do that. So we are school volunteers for that. And I remember some of these patients, they were like so happy to see us. A lot of them, they didn't even care about us brushing their teeth. They just wanted to talk. They wanted that attention from somebody. And I was very fortunate that, I'm like a parrot. I love to talk. So I was talking to these patients and actually build relationships with them, because we used to go every so often. And it was just beautiful to hear their wisdom, to hear their experiences in life. Sometimes it's not just about doing the cleanings, but as dental hygienists, we are also like almost like therapists in a way. We get to listen to people's issues, concerns, fears, anxieties, problems. Like they just want to sometimes let us know all their things. And in our minds, sometimes it's like, baby girl, you only got an hour for your cleaning. But we need to not have that type of mentality, because sometimes us listening to them can make such a difference that the cleaning is not as priority sometimes. Sometimes being emotionally there for them, it's better. And I feel like that was the case when I was going to the nursing homes or the hospitals. Sometimes people didn't want me to brush their teeth. They would say like, oh, I want the hygienist to come in, but I don't want her to brush my teeth. I just want to talk to her. And I would sit there and listen to them and talk to them. Let's talk radiology, baby girl. So in radiology class, we obviously had to learn the lecture part and then doing it manually. And we learn about film x-rays, which are, I wasn't a fan of. Let's say I took all the x-rays on a patient. Like film x-rays, you can't see them right away. You had to go to the dark room. And if somebody opened the room while you were, exposing them, like, bye, like your x-rays are done. So I really didn't like that part of it. I like digital x-rays better, but I felt like it was hard for me to understand radiology. So that class I did struggle a little bit. Just know that in hygiene school, you will learn the basics, the foundation, but there's so many new things when you get out and you start practicing that you're gonna learn on the job. So in my office, I learned to take 3D radiographs. I learned to take extraoral bite wings. Some of these things are not taught in hygiene school, but they are mentioned. It's just that they might not have the equipment or the technology in the school yet. But again, you get the foundation and the basics, so you will be more than prepared to go out in the real world. I think that is it for today, baby girl. We are done with the vlog. Comment, like, and subscribe. And as always, it's a pleasure doing this for you guys. So stay tuned for more. Bye. Adios.